Hey everybody, I'm Dr. John Willardsen, and recently, actually this week, I got a call from a patient who lives out in kind of middle America, and in this area he is in, he's not finding somebody who can properly treat his case, the entire case. He's found a good oral surgeon, but he's had a difficult time getting the case restored. So I kind of want to take a look at this because it's very classic. It's indicative of the marketplace for dental implant reconstructions. Like we've talked about in some of my other videos, you've got the classic or typical corporate all-on-4 centers who are going to push all-on-4, and that's kind of the only thing that they have in their wheelhouse to do. Or you've got the private practice, and sometimes the surgeon's pretty good, but then the restorative aspect or the teeth fabrication process, it kind of falls apart. I've seen this countless times. In fact, I was just kind of going through some of the comments in my YouTube channel, and many of the comments are like, man, I wish you were close by because I've had this issue or that issue getting my implants restored. And this is a very typical situation. So if we take a look at, here's a before x-ray. This is when he had the teeth. And, they did need to come out. So the doctor went ahead and removed some of the teeth. And then he put in 3 implants. Now, granted, this went on. It's been going on now for a couple of years. So I can just kind of put myself in the patient's situation where, now he's got, if you look at this x-ray, he's got, nowhere to chew really because he's missing all of his teeth here on the upper left. He's got some implants there, unrestored, and then he's missing all of his teeth on the lower right. So this patient is kind of fallen into and is subject to the system, so to speak. He's totally held captive to the system. And so ultimately he went ahead and they extracted all of his teeth, put in, all of these implants, and now it's still been years down the road and he's been going around like this, no teeth for a long time. Not to mention he spent a ton of money. He's, I don't know exactly how much he has invested this up to this point, but to have invested not just all the money that he's invested, the time that he's lost, the every day that he goes try to eat something, he's having a hard, he can't eat. And so, I was able to have a Zoom call with the patient and, he's, I think he's going to be coming out to California to have this work done because I know I can streamline the process. Now, what I'd like to go back to is, had I seen him in the very beginning, this case would have been done, within about 3 months. Just looking at the available bone that he has, had we kind of stuck to a program and a system, we would have been long finished with this case. And he would have saved a lot of money because we do have those systems in place. We can expedite the process and get the patients and cases finished. But in some of these corporate, all-on-4, N4, D4, whatever implant centers, they are going to push everybody into the all-on-4. Generally, they give them a plastic hybrid, which is a titanium framework with plastic teeth. And a lot of times the surgeons or general dentists who don't have surgical training placing these implants, and then sometimes it's either a general dentist or a prosthodontist doing the restorative. And the continuity is broken up. Whereas, if you can find a center that you've got somebody who has skilled, background training and the skills in doing comprehensive full mouth reconstructions, you can avoid so much. You can avoid the time lost, the money lost, expedite the case, get it finished. This poor guy has just been struggling for years now without teeth and a lot of money invested. So it's really important that you seek out and find, even if it's across the country. I'm not saying everybody come to me, but it is important when you're investing in doing this sort of a reconstruction with your mouth and your teeth, that you find somebody who is confident, that knows and can complete the case, finish it in a timely manner, and have results that they can, that they can trust. So anyways, I thought this was an interesting case because we see, and both on YouTube and in our own private practice, lots of patients who have fallen into this trap where they've spent a ton of money, lost a lot of money, lost a lot of time, and still have no resolve. As kind of I had mentioned before, when we had taken over these couple of implant centers, and we saw patient after patient who were in this situation, and the frustration is insane. They're very frustrated. So that can be avoided if you choose wisely and you make that decision and you stick with it, and have somebody that knows how to take it from A to Z. And there's just it's a very straight path. There's no deviations and going one office to the next or one doctor to the next. It does not have to be that complicated. The surgeon placing the implants and doing the restorative, if you have that mindset, you're going to place those implants according to the design of the prosthetic that you're going to deliver for the patient. All of that has to be pre-planned. You got to know where you're headed, before you start going. And so, this is a very typical case of not really knowing where they were going. They had no idea where they were going. I mean, we wouldn't have this second x-ray if they knew where they were headed, because they would have just gone in, taken all the teeth out, and placed the proper number of implants, known what prosthetics they were going to use, what materials they're going to use, how many implants they're going to use, whether or not they needed to graft the sinus or not, or, there's just so many variables in doing these sort of cases that all of this has to be known preoperatively or before. And as you execute on the case, it goes so smoothly because you know where you're headed. It's not a difficult thing. Whereas if it's bouncing back and forth between different offices and different doctors, and there's no like head chef, so to speak, then it kind of falls into this no man's land. And it's not the doctors who suffer, it's the patient. The patient suffers. He's the one who's had to bear the burden of having no teeth for years and years, having had spent so much money and having bounced around from one office to the next. And so he's the one that suffered. So as a patient, if you need this sort of work, it's imperative that you do your research, look for somebody who has a skill set and that can deliver on what they've promised, and that you kind of have an idea, and our sixth sense is very important. When you go into the office, like you can sense like this guy knows what he's doing. There's very clear as to where we're headed, and so I can trust in that process. Or you may feel like, I feel or sense a lack of confidence here. So, follow that gut feeling, follow your gut, and know that, it's important that this sort of reconstruction is so critical. It's life-changing, it's transformative, like I always say. But it's true, we have patients that every time we deliver a case, and they're like, wow, it's incredible. And so, you either have that kind of result, or you have this sort of result where the frustration is just insane. The patient's so frustrated, willing to literally drive from the East Coast to California in order to have this work done. So, that's a pretty, big sacrifice, so to speak, and it doesn't have to be that hard. Anyways, I thought this was kind of an interesting case. Wanted to kind of review it with you guys. If you have any questions, comment below, give us that subscribe and like, and follow us for more content on dental implant reconstructions. If you're in the market for implants and you need your mouth reconstructed, we've got so much information here that we can share with people that are looking for that sort of thing. Thank you so much. I'm Dr. Willardsen.